So, Dr. Zapata, some exciting news this week.
Yes.
We've heard that COVID-19 vaccines are going to be authorized and recommended for children 5
Yes.
to 11. We're both parents of
Yes.
children 11 and under, so it's exciting for us personally. But as a pediatrician, what's your approach to talking with families, parents, and young children about whether this is the right thing for them?
Yes, great question. There have been a lot of there are some parents who have been anxiously awaiting this moment, and they're going to be first in line. There's high demand. But then there are some parents that are in the middle of the spectrum, and they're kind of going to just wait and watch and see. And then there's still some families and parents that are saying, absolutely not. I am not going to get this for my children. And the way that I approach it is just being respectful, no matter where people are on that spectrum, and just being open and ready to have conversation. So that's what I have been doing, and that's what is very effective, just being non-judgmental and having open and honest conversations, giving information and letting people know that it's safe and effective for their children, and one of the best tools in our toolbox to combat this pandemic.
Thank you.
Mm-hmm. And what are some ways, like with your own children, what are some things that you're actually saying to them as far as being anxious about a vaccine? I know that one of my children in particular hates needles and does not want to get it, but what are some of the conversations you've been having at home?
I talk about vaccines as superpowers.
Okay.
When you go and get your vaccine, it's almost like magic. It's training your body's cells and molecules to respond to a virus or a bacteria that could really make you sick, and it does it in a really reliable way that's very effective, and so we try to frame it positively. This is giving you new equipment, new defenses against germs that are out there that could make people sick. I think that's useful for some children, those that are into superheroes. But I think in general, like as you were saying, the most important thing, and the reason that physicians are really trusted is that our primary job is to listen to people when they have concerns, and then we can respond to what their specific concerns are. So I think that's good lessons for us in public health and for all of us in medicine, that wherever someone is on that spectrum of you can't give me the vaccine early enough, or there's no way I'm getting it, meeting people where they're at,
Exactly.
giving them the information that science has told us is true about the vaccines and their effectiveness, and not judging people. I think that's really important.
I totally agree. I'm going to use that at home tonight, talking about, hey, let's go get your superpower. One of the things that was very striking to me as looking through all the data and numbers was that as of October of 2021, of this year, there's been over 700 children under the age of 18 who have died from COVID-19. And some may say, in the big picture of everyone who has died from COVID, that's a small number. But even just one death of a child from something that's preventable is unacceptable. I personally, many years ago, my little brother passed away. He was only 16 years old. And he didn't, of course, it wasn't from COVID because that was not here yet. But watching my mother go through that, it was hard enough losing a sibling, but watching my mother lose her only son and just even still working on healing from that now, one child that is gone too early and too soon is devastating, and that's one too many. So when I see that number about over 700 children have died from COVID-19, it's heartbreaking, and that's another reason it's so important to get the word out about the vaccine approvals for children.
I agree. I'm so sorry about your family's loss. That's really heartbreaking, and I agree. Every preventable death is tragic, and we've got power.
Yes.
We have strategies, we have treatments that can prevent people from dying of all ages, and that should be something that we celebrate, that we work together to get people vaccinated, to make sure that people understand the multiple different strategies to prevent COVID-19. The numbers can be mind-numbing when you think of 800, 700 plus thousand deaths in the U.S. 8,000 people died in Wisconsin during this pandemic alone. Number one cause of death during some months. It's really tragic, but every one of those statistics is a person in a family. And as physicians, we have to look at it that way as well, and give people our best advice on how to keep them and their families safe.
I definitely agree. And let's talk about the elephant in the room, if I can say that. What a lot of parents are talking about is the side effects. And when you go through social media or you see things that even if the side effects are extremely rare, who is the news going to cover, or what's going to be blasted on social media, those rare side effects, even though they are very, very rare, and the benefits of getting the vaccine outweigh the very small risks of getting it. Can you talk just a little bit about how you approach that conversation when people are worried about the side effects?
Yeah, well, I think we've learned that some side effects, or mild side effects in particular, are pretty common with COVID-19 vaccines, particularly after the second dose if you're getting a 2-dose series. But they are mild, they last 1 or 2 days, and severe complications from vaccines are extraordinarily rare.
Right.
And long-lasting side effects of the vaccines almost don't happen. So when you think about it in those terms, and then you think about what we were just talking about,
Right.
hundreds of thousands of people have died from COVID. COVID-19 causes severe disease, people in the hospital on a ventilator for weeks at a time, can cause severe disease even in children. You know, the risk benefit of taking COVID-19 vaccines is a really clear choice when you can try to look at the trade-offs. Vaccine side effects are mild. COVID-19 can be very severe.
Right.
And so when we try to coach people on making the healthy choice, weighing those risks and balances, the benefit always comes down on getting vaccinated.
I definitely agree. And speaking of the vaccines, one thing that I'm very excited about, which DHS is partnering with other organizations and schools, is using getting the COVID-19 vaccine for children as an opportunity to also get them caught up on some routine vaccinations that they have been behind on. So I'm really excited about all the collaboration that's happening on that front too.
That's true. Vaccines save lives from a large number of different infections. There's been some evidence that during all the disruption that COVID had on healthcare and schools, that a lot of young people fell behind in their vaccines. So I agree, that's an exciting thing, and something that we want to make sure that our healthcare partners know about, is that you can get COVID-19 vaccine on the same day, at the same visit, as you can get other vaccines, including influenza, which is now flu season again.
Yes.
So getting your flu shot and your COVID-19 vaccine around the same time, or even the same day, is certainly a fine thing to do and efficient.
Yes, definitely. And another thing that is very important to me and that I'm really excited about is the increased awareness about children's mental and social emotional well-being. We have seen over the pandemic that there's been increases of anxiety and stress and just negative feelings. And so in addition to all of this talk about vaccines and physical health, is so important for us to continue to talk about the social and emotional well-being of children. So I always go home and try to find ways to get in touch with my children's emotions and feelings. They always say, "Mom, stop asking us about this. We're fine." But it's so important. What are some of the conversations you're having at home, or things you do to strengthen your kids?
Well, I think that's such great behavior to model, both with in your kids and your family, but also, as we talked about, among your coworkers and your peers. Because people can be struggling and suffering in ways that we won't know about unless we ask, and so that's an important role for us to have to keep the people that are working alongside us well and feeling supportive, as well as our families. So I really think you nailed it. Just asking the question and being present and being available for people who need our help.